Hello and welcome to the podcast series sponsored by Rainbow Hospitals. I'm your host, Pallavi. In this episode, we are focusing on pregnancy after 35, a phase that's no longer rare, but still filled with a lot of confusion. To help us understand all these things, we speak to Dr. Suchithra Reddy, OBG Infertility Specialist, Rainbow Hospitals, Bengaluru. Hello, Doctor. Welcome.
Hi.
Doctor, beyond biological age, like our topic is pregnancy after 35, what exactly changes in a woman's body that affects fertility?
So, according to medical terms or medical terminology, 35 is being taken as a target where we have seen multiple changes which happens in a woman's body, either physically or according to what you told us, biological age. So, this biological clock begins to drastically decrease after the age of 35 years. We have seen reduction in the egg number, which is quantity, and egg quality also decreases. So as the age increases, when we see these kind of an effects, there is increased chromosomal abnormalities, which means the DNA abnormalities happens, which might increase the abortion rates and reduce the chances of conception by itself. So even if you conceive, so you would have heard called as Down syndrome, which is a chromosomal 21 which gets affected. Most of the chromosomal effects, if it is there, it gets aborted before 12 weeks itself. But here there are certain other chromosomal defects like 13th chromosome, 18th chromosome and 21st chromosome. Still if they are pregnant, they can continue till delivery. We will not know. But we do certain investigations to know these 3 chromosomal defects by around 3rd month, and then if it is normal we continue the pregnancy, otherwise we terminate. So these chances are high after the age of 35 years. Why? Because in the younger women the egg quality is good. Even there are mild DNA abnormalities, it can autocorrect. But as the age increases, this autocorrection of abnormalities reduces. So that is why it is important to choose when to become pregnant. And it is like most of the time now women are choosing their career. So they have to plan accordingly because biological clock doesn't stop.
Right, absolutely. Does this affect even if a woman is having a very good healthy lifestyle, watching out on her diet and everything?
Being healthy doesn't mean you are fertile. Healthy habits following or doing a healthy activities and all those things definitely can improve your health to certain extent and also the fertility health, but it doesn't guarantee you that you will not have an abortion or your egg quality will improve or your biological age will reduce. It definitely has an improvement. It will help, like if you are planning for the conception, it might take lesser period for conception than taking longer duration. It will help in balancing your hormones definitely, so that the ovulation timing variation doesn't change as you are being healthy because your hormones are maintained. So usually what will happen, you should not overdo anything. Exercise to a moderate quantity. Over exercising also affects the fertility, because when you are under chronic stress and more exercises would lead to certain hormone called as cortisol, which again impacts your GnRH hormones, which is needed for the ovulation and egg quality improvement. So this also will affect your egg quality. So anything which has to be done on right thing will be helpful, and healthy women always has benefit. When you become pregnant also, the complications will reduce. Like your weight gain might be reducing. If you have an insulin resistance, but if you are working out properly, this insulin resistance would reduce. So it will help in certain reduction in miscarriages and easier conception, but it doesn't affect the reducing number of eggs or quality of the eggs or the DNA damage which will occur otherwise also if you are more than 35 years.
Are there any subtle signs that women get to know when there is a fertility decline happening?
So definitely, but most of them they ignore these subtle signs. So in the early 30s or late 30s, there could be a minimal variation in their cycle pattern. So if they were getting their cycles around 30-35 days, now it is being reduced to 28-30 days or 26 days. This variation in a minimal duration of period also has an impact. So this tells the earliest sign to know that your egg number is getting reduced. But these signs are most of the time they ignore it. And there could be a variation in your cycle pattern also. So you are getting your periods or bleeding heavily in the first few days, but now it's been spotting is there, and then you are getting your periods. This could also indicate there is hormonal imbalance which can be affected in the body. So these things are also ignored. So most commonly the cycle shortening and pattern of bleeding impacts which appears earlier during the periods.
Like you said, after 35, the egg quality reduces and the number of the eggs also reduce. What can women do to, improve it?
So women can do certain things to maintain it, or what we can tell is to improvise it, but we cannot increase the number or we cannot reduce it from declining it.
Okay.
So there are no procedures or no medications which will increase our number, because women are born with certain number of eggs which reduces as their age. Utilization of eggs happens once you attain your periods, menarche. Okay, from then every month egg utilization keeps happening, but this utilization is drastic after the age of 35 years. So we cannot do anything to reduce this decrease, but we can acknowledge like okay, I am not planning my pregnancy during in the first few years or something after the marriage. Then you can do certain other things like preservation of eggs and all those things can be definitely done. And certain things which you can do is utilization of certain medications like CoQ enzymes and antioxidants. So these will help in improvising the quality, but we cannot increase the quantity.
Okay, you spoke about egg reserve. At what age do you recommend women to reserve their eggs?
Early 30s or late 20s would be an ideal age for preserving your eggs. So you are around 25-26 years, but you are not planning anytime soon to get married, or you want your biological kids later on sometime, but you do not exactly know when you want to become pregnant. So in that age, if you are educated, your family is all okay, no pressure, you can improve your career, all those things, definitely at that point of time you can preserve your eggs if you are not married. Okay. But you are married but doesn't want to have kids anytime soon, you can preserve the embryos. Always preserving embryos would be better than preserving eggs if you are having a partner.
Okay.
Because the chances of embryo preservation and recovery is better than egg recovery. We tell like if 10 embryos are preserved, all 10 can be alive when we unfreeze them. But all 10 eggs may not be alive. Only around 85-90% of the eggs which we have frozen might recover when we refreeze them. Not all eggs gives us embryos.
Correct.
So if you have around your age is 25 or 30 years, you need around 10 to 15 eggs for you to get good number of embryos. So if you have already 5 embryos, then you know that the probability is more.
Doctor, would you recommend any tests for women, like after 30, go through these tests?
Yeah, there are few basic investigations in case of a female partner. There will be a test called as an AMH, which is a blood test. It's called as an anti-Mullerian hormone, which tells us our egg reserve.
Okay.
So usually it should be somewhere between 2.5 to 4.5. If that is there, it is absolutely normal. And a blood test called as serum prolactin, which is a hormone which comes from the brain. So this hormone usually is high during your pregnancy and when you are feeding the baby, during lactation. But otherwise, this should be less than usually 25, we call it as. Okay. So when this hormone is also on the higher side, it also impacts the ovulation and implantation. So this test is often missed out by many people or many doctors whom they gynecologists might miss out. But always it is important to do this investigation. And also thyroid hormone. So thyroid hormone, usually it is normal if you are not becoming pregnant, even if it is little on the higher side. But when you are planning for a pregnancy or when you are pregnant, there are certain other limitations which we see. We have to treat those lower values also, called as subclinical hypothyroidism. So that is very important. So these 3 investigations in a blood test is important.
Whether a woman is married, not
married, these investigations are important. So ultrasound, we call it as an antral follicular count, which is usually done on second or third day of the periods.
Okay.
So this also tells us the egg number in each ovary on your second or third day of your periods. So this is also a very important. So we can correlate the ultrasound with your blood test. So then we can analyze accordingly. And in case of a male partner, semen analysis is very important. So only one investigation, this is semen analysis with an abstinence gap of 2 to 5 days. We ask them to give the semen sample. So if the semen report is absolutely normal, no further investigations are needed. Okay. So if it is abnormal, then we ask them to do certain other investigations.
Okay. What lifestyle mistakes do women do unintentionally, right? Which is probably affecting their pregnancy chances or motherhood?
Yeah, so most of them think that as I told you, being healthy means they are fertile. So definitely not. So even if you are healthy, your fertility might be masked. So you earlier detection is always better than feeling sorry. So if you think that, oh no, I'm doing everything right, I am fitter, so my fertility will be always normal, I need not do any investigations. So that is a wrong idea which they have. So even if you are fit, healthy, you have to do certain investigations which otherwise will not be done in your regular health checkups.
Right.
So you have to make sure that your general health is different than the reproductive health. So always you have to get your reproductive health being evaluated. And most of them think that they're eating healthy, but they use unhealthy containers to eat it. So they use plastic containers to eat a salad. Why should you preserve a salad in a case of a plastic containers? And they wrap the salads or wrap the foods in foils. So these are unhealthy things and they think like occasional alcohol or occasional smoking is not going to affect. Only I'm doing only once or twice. No, it's not going to affect. This habit might continue. Monthly once can happen or 15 days once can happen, but cumulative when you take that, this definitely affects your egg quality and it causes DNA damage. And it also impacts the embryo formation and implantation also. The implantation means the embryo, once it is formed, it has to get attached to the uterus. So if this is also going to get affected. And also sleep deprivation. Seeing long hours of phone, or most of them are IT professional, long hours of screen time, usage of internet, mobile phones also having internet, Wi-Fi in the home, they're not offing it. Throughout the day, 24 hours, 365 days, you are getting exposed to the internet. These things also are going to affect you in a long run, definitely. Sleep deprivation, I tell that instead of having a proper number, regular timings you have to follow. It's like you are sleeping every day at 10 o'clock, getting up at 6 o'clock or 5 o'clock is still fine. That proper sleep duration and the fixed timing is very, very important, because sleep deprivation again impacts the body in so much ways that it affects the mitochondria, we call it as, in the egg. So this is the energy which gives to the egg. So that if it reduces, the egg quality reduces and the cell damage increases. So all this combined together, see, individually one thing you are doing, the other things are fine, you might not know much, but when this all combined together, your body is getting affected and the fertility gets affected.
This applies to men as well.
Men,
right?
definitely. Definitely. So people think that pregnancy means it's a duty of female. No, definitely. Men also, there is, as the age increases, reduction in the sperm quality happens. So if you take a target of 35 years in a female, male happens after the age of 37 or 38. It can happen even before if you are alcoholic, smoker, or not sleeping properly, having more stress and all those things. It causes a certain thing called as sperm DNA fragmentation. In a young woman, when there are multiple times miscarriages which is happening, it could be the reason of a male partner than the female partner. So male partner, his habits are also very, very important, which impact. So we tell that every 85 to 90 days there is a new sperm production which is going to happen. So when you are planning for pregnancy, it is important that the male partner detox himself and all his bad habits to be stopped at least 3 to 4 months prior they plan for pregnancy. That is very, very important.
Absolutely. Now that's like, it's just not a woman's duty.
Definitely.
A man is equally responsible.
Equally responsible.
How does pregnancy after 35 affect the health of a woman after she delivers? Is there a adverse effect of it in the long term?
See, usually what will happen, even pregnancy before also, if they have a complications, it's going to have an impact later on your life. But after the age of 35, having a complications during pregnancy itself will increase. See, what will happen, even if you're not pregnant, you are more than 35-36 years, chances of you getting diabetes, hypertension increases. But when you are pregnant, these chances doubles with the age. So Asian population itself is risk for gestational diabetes during diabetes during pregnancy. But if you have a risk factor like in your family, if your father, mother diabetic, hypertensive, so the chances of risk increases after the age of 30. This risk doubles after the age of 35 years. Okay. So if you are fit, healthy, you don't have any complications, and you follow everything religiously, like taking proper calcium supplements, post pregnancy also you are exercising properly, you didn't have any complications, you are maintaining your exercises, everything during post pregnancy also, you might not have major complications in a long run. But you had during pregnancy like gestational diabetes, it might have an impact of cardiovascular defects also, or hypertension if you have during pregnancy. Later on in your life, you might have certain heart problems. So these things, it might be an alarming signs also, or you might, if you ignore, you might have the complications later on in your life. So a pregnancy can be a boon because it detects certain things early, so that you might be cautious. It might be a win also, like if you ignore these things, you might end up in having certain other things. So as the age increases, there is one more thing, like thyroid problems also can happen, and certain other autoimmune diseases also might flare up. So these things also have to be managed during pregnancy, and post pregnancy also you have to be careful. So now pregnancy is done, so even if your sugars are normal, if your BP is normal, you just don't care about it, then later on it might get affected. And also during pregnancy, the bone density also reduces. So proper, as I told you, proper exercise and proper supplements is definitely going to help you in a long run. If you are not, then having other health issues might definitely be there.
Okay. Doctor, before we wind up, at what age medically do you recommend women to plan their pregnancy? One, and your message to women who are planning their pregnancy post 35.
Okay, so ideally it's early 20s where the fertility is high would be great when you plan for pregnancy. But practically when we think, even the late 20s and early 30s is always ideal when they can plan for the pregnancy. Check, evaluate yourself properly, and before you plan, definitely, as I told you, maintain exercise at least 3 to 4 months before you plan for your pregnancy, and take the required supplements, both male and a female partner.
Alright. Thank you so much for sharing a lot of information, doctor.
So thank you, Happiest Health, for me to be here and sharing my thoughts regarding the topic which you have given. So I think this information will be helpful for all the women and men over there who are planning their pregnancy in their late 30s.
Thank you. Thank you so much.
Thank you.